My name is Celeste Joyner, and I am a family child care provider, and I've been in business now for almost 24 years. During this pandemic, me and my husband had to have a conversation, a very hard conversation, because he was diagnosed with congestive heart failure. So I had to kind of hold things in to see if I was going to become an essential provider or not. He told me it was going to support me. My enrollment went from 8 children to 2 children, and that's a huge decrease in income. Protocols have totally changed because social distancing with young children is very, very hard. There's no more hugging. There's not even no more fist bumps. And I have to stop the children and say, no hugging. We can't hug right now. I've always sanitized, but it's a lot more than what I used to. Every 5 to 10, I'm wiping down a chair. I'm wiping down a table. So I go to the store every week and it's nothing there. It's nothing there at all. No Clorox wipes, no Lysol wipes, no bleach, no hand sanitizer. There's nothing there. I hope to stay in business, but the way childcare is going, who knows? We really don't know at this time. We just don't have a clue. Everything is just going to be different with childcare. Nothing is going to be the same anymore. Social distancing, like I said, it's very, very hard with young children. It's very hard because they bump up into one another. They touch one another. I mean, children like to touch and they like to feel things. So it's going to be really hard to stay in business that way. I just think it's going to be a little different. First and foremost, I think they should offer us health care. They should raise all subsidies for people who need help with childcare. They need to provide more grants for us as well. And also just make childcare essential, that we are essential.
Childcare is essential for many American families to be able to return to work, but nearly half of childcare providers have completely closed their facilities, and many may not ever reopen. Closures of childcare providers means more demand for the providers that do reopen and fewer spots for children. In addition, necessary enhanced health and safety measures due to COVID-19 could lead to providers serving fewer children. An overwhelming majority of Americans support providing targeted financial assistance to the childcare industry. Initial efforts to bolster the childcare industry are a start, but funds are already running out or didn't reach the entire industry. Let's ensure that providers are there so that families are able to get back to work when it is safe to do so. Congress must act to ensure that childcare has the robust, dedicated relief it needs. Visit childcareaware.org to learn more about how to advocate for childcare. It's as simple as this: no childcare, no recovery.